All right. Well, I'm happy with the young audience we have today, because I think you are going to be the ones that are going to do what I'm going to talk about in the future. I'm going to talk about short missions in low resource settings, and one of the things that look at the subtitle "Fun or Frustration." When you start doing this, you'll find out there's a lot of controversies in this issue, and I will address them hopefully one by one. There you go.
I think the microphone is not working, but everyone can hear it, I think. Yeah, it's just for the recordings on the camera, so it's not for the sound.
Okay. All right, so.
Listen very well.
Now, let's assume you are a qualified specialist and you think, okay, I've always wanted to do this and now I'm finally qualified, and I'm going to a country where I can be of use, and obviously I have a job, so I can't go away for a year or so, but a couple of weeks should do, and how can I make myself useful? So you go there and you feel that you should be very welcome because you come to provide help. You work for free, you take days off to do this, etc. And then you come there and you see that nobody is there to roll out the red carpet, and they are not standing there applauding you in. And for some reason, it doesn't work out like you expected. And that starts with the government. The government maybe wants money out of you. They charge you for a working permit. They charge you for a registration in a national medical register. They want to check your qualifications, and you think, well, hey, I'm the big specialist from abroad. You see, you have to acquire papers like this. And then the hospital, they want to charge you per patient you operate there. And the hospital wants to charge the patient that you offer to operate for free. They withhold their resources from you. They make you pay for your lodging, for your food. None of this is what you expect, because you think you come to do good, and they will hold you in with open arms. And then there's the local doctors. They do not seem very enthusiastic, because they will not stop or postpone their operating program. They want to charge the patient that you operate for what you do. They will not let you use their instruments, and they won't listen to your good advice that you strongly put on them. And there's the local theater staff, the nurses. They want to be paid to help you. When you come there, put in time, do it all for free, and then they ask money. They don't want to work in the weekends. And you only have 2 weeks, so you want to do the Saturday and the Sunday as well. And they don't do what you tell them, because they're used to do it their way. And you know that your way is better, and you tell them, but they don't do it. So they don't listen to your good advice. And then there's the patient. They don't talk your language, and you don't talk their language. And they don't seem to trust you. And then they expect the impossible, because they ask you to treat conditions and diseases that you have never seen before. And it's out of your field of expertise, because you go there, you're a plastic surgeon, and then somebody comes with a gynecological problem or with an anal fissure or whatever, and you're a doctor. You can treat this. We've heard this before upstairs, but that's the way it is. And you feel very uncomfortable if they ask you that, and if they pursue doing that. So you go home, and you're very, very frustrated. You haven't been able to work as hard as you wanted to, and you feel that you have not been welcomed the way you should. You spend effort, time, money, etc. So chances are you'll never do it again. Well, obviously this is a worst case scenario, but everything I said, there's an amount of truth in it, in everything I said. And it all happens because it all happened to me and to Jan and to Rick, So luckily enough, normally it does work out. and you do some good things, but if you look at it from the other side, you know, why is this so controversial, and why do people treat you like that? Well, do you think that our government, your government, would allow any African doctor to come in and say, hey, here, I'm here to help you, you know, close the OR because I'm going to take over for 2 weeks, and you know, would your nurses say, oh, I'm in, I come on Saturday and Sunday, no problem, and I don't need to compensate for that? I don't think so. But also, there is a downside, and there's a little bit of black truth to what I said. Some governments do see non-profit organizations as a source of income, and they do want to profit of it. It's not right, but it's a fact. The same goes for bribes, corruption, etc. It's not nice, it's not right, but it's a fact. And the local personnel, the doctors, the nurses, etc., hey, they're just trying to make a living like we do, and they expect to be paid for what they do, which is completely normal, because we all do that in our own normal setting. And the hospitals, they do have very limited resources, so don't look so surprised if they say you can't use everything we have, because you go home after 2 weeks and we still have to do like for 6 months with the supplies you have used. So there are controversies, there are misunderstandings, and there is a sort of logic to it. But how can we put this in a format, in a form, how can we do this in a way that makes it work? What can we do to improve the energy we do want to put in these short medical missions? Now, there's a little bit of philosophy in what I'm going to say now, and it starts with the question, what's good aid? And I think medical aid is somewhere between the individual help and to create a self-sustaining national healthcare system. And I challenge everyone to try to do that, because it's not going to work. That is something that should come from a government, and the only thing we can do is be somewhere in the middle. Help individuals, normally the bigger non-profit organizations, try to be somewhere in the middle. And if you look at another way of looking at this, you know, it all is between patient care and structural aid. And structural aid means, in my opinion, that you change the system in a way that it improves and it is sustainable. In between, there's the instruction and teaching component, which I think is extremely important. But let's be honest, what's wrong with patient care? I think there's absolutely nothing wrong with that, and it's the very basis of healthcare, and probably the reason we all went into healthcare. So I think we should not be taken aback by people that say, you know, it's only a raindrop on a hot piece of metal. And I say, you know, it may be one drop, but if you put a red hot plate of iron in a downpour of rain, it's going to cool off. So it's also a matter of how many drops do we provide. And if we all are that little one drop, then the metal is going to cool down. So how to do it right? Some tips and tricks. There is no one-fits-all solution as far as I can see this. After 20 years of experience, every situation calls for its own approach. But I'm convinced that short medical missions can be a valuable way of helping people. Short missions can provide individual patient care, but they can also provide teaching to local healthcare workers. So we're going to talk about a few of the tips and tricks. The best way to get a good result is to start early. So get your necessary paperwork done ahead. You know, take care of financial affairs. Look into them up front. So check out the cost of the expedition. Make sure that you have the funds, and especially look into things like travel expenses, etc. That's obvious, but also you want to carry materials. Or do you expect that the locals will have as many or as much as you will use? What are you going to do about the local staff? What are you going to do about the hospital, the local doctors? Think of that. Think of that on forehand, and then, you know, at least you're ready for it, and you can also in advance arrange things like send material. I wouldn't send everything because it can be tedious, can be difficult to get things through customs. Try to avoid that. Try to take contact in advance and carry the most important items with you, like surgical instruments and anesthetics. Logistics, transport. If you arrange it up front, it's always better. More things to think about. What surgery are you going to do? Now, this is the internal dilemma, controversy within yourself. That's what is needed, but it also depends on your expertise and the local situation. And with local situation, I don't mean the local demand, but maybe the local facilities. And who's going to be in your team? Are you going to involve the local staff, which I think you should, and as much as you can, cooperate. Don't take over the hospital, send everybody home and work there for 2 weeks and then go out again. That doesn't help. Of course, you have helped the patients you operated, but it doesn't help. It doesn't do anything in terms of training, in terms of structural aid. So try to involve the local staff as much as you can. It also depends on what you are going to do. Because sometimes you need to expand your team because you need specific skills, and also in terms of communication, it can be easy. It can be save you a lot of trouble if, especially, the non-sterile nurse can understand you. So if you are scrubbed up and you ask for something in theater and your scrub nurse understands you, but the rest of the theater doesn't, it's kind of difficult to get what you need. So bring your own if you really need them. Preferably use local. Also, hospital management, contact in an early stage. And you need to ask yourself, do they need you? Do they want you to come? Because I think that's essential. You can't just impose upon a hospital or a local staff and say, hey, here I am, I come to do the good work. The ideal situation is they ask you to come, and you make an arrangement. So offer teaching, offer lecturing, make it interesting. And also check with them, how about the available beds and the available theater time? And do they want to get paid per patient for what they put in? Or is it okay with them if you operate for free and they offer the patient their aid for free as well? Which often is not the case because they can't run a hospital out of thin air. So the local doctors, same story. Try to make contact in an early age. Now we're in the internet time. That makes it a lot easier because quite often they do have internet access. So you can get into touch with the local colleagues and try to find out what their needs are, what they want. Do they want you to come? And if they do want you to come, for what reason do they want? Because I don't think there's any gain in going there and operate things that they can operate themselves. You should provide a service that they don't have, and you should try to help them by teaching, by instructing, by lecturing, to be able to provide that service themselves in the future. And that helps if you continue to go to the same spot year after year. So offer email consultancy. Let them send you pictures before, so you can make up a plan, discuss it with them. Say, we want to do this, you have the materials, should we bring the materials? Cooperate. Bring some books, give lectures. So then, okay, now we've talked about this. I think now we have had so many tips, we're all set, let's go. But still, there's more considerations. Intraoperative care. Think about anesthesia. We just heard a talk about how important anesthesia is, and we think it's normal to have an anesthesiologist at the head of the bed. But in many countries, there is no anesthesiologist. It's just a nurse who provides anesthesiology. And you should be prepared for that. And you should also decide what procedures you want to do without an anesthesiologist. Think of hemostasis. Is there electrocoagulation or not? Do we have the right instruments, etc., etc. A microscope if you want to do complicated surgery. So for local facilities, they are often lesser quality than you expect and than you think. So you have to keep that in mind with the choices you make. Post-operative care, same story. Quite often there is no ICU, or at least not an ICU with a machine that says beep. We heard that before. Quite often there is not even a recovery, because the nurse sticks their head out of the room and shouts, "Sister, shelter," and then somebody comes, picks up the patient and rolls them straight into the ward. So keep that in mind. No radiotherapy, no physiotherapy, rehab, follow-up. Who is going to do your follow-up? Because if you operate for 2 weeks, these patients have to be taken care of afterwards. And I think, personally, that's the most important thing in the whole process. Take care of your patients afterwards. So think about choices you make. We said, what are you going to do there? Complex, time-consuming procedures, help a few patients with a high risk of complications, versus simple procedures, help many patients, high satisfaction rate. Well, everybody says, oh, no, we're going to do that. Not necessarily, because there's many factors that play a role in this. Sometimes the very question to you to come and help out can be this. Like if they say, we can do all this ourselves, but we need help with that. Puts it in a different perspective, but you have to think about it. You have to try to figure it out before you even are on the plane. So then again, like I said, when you come and go do that, think of this. Because if you do complicated operations, someone has to do the follow-up. Do you want to do oncology? Or do you send these patients home? Think about it. You want to do complex things like microsurgery. It all depends on the local facilities. If this is the local setup, don't do oncology. If this is the local setup, think about it. And who's going to take care of the failures? If your flap fails, who's going to do plan B? And do you have a plan B? So know your limitations and those of the rest of your team, especially the anesthesiologist, and those of the hospital, etc., etc. All these are questions, you could say controversies. On the other hand, if you don't do it, the patient is very likely to be not treated at all. Nature is forgiving, the African is tough. That's what I always say. And it took us through a couple of hairy situations, but yeah, we've heard it before. I mean, we've had a fantastic lecture on war surgery, and I saw like 10 medical specialties on the board, and they were all done by one general surgeon. Well, I could show you a slide. I took it out of about 8 specialties that were done by one plastic surgeon. But it's something you have to consider. You know, it can be very nice for your patients to step outside your comfort zone and try to solve a problem, even if you think, I don't feel completely safe. So, aftercare, 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 and this is something you really, and the best way to treat this is communicate with the local staff. Explain to them, involve them in the treatment, and if they are involved in the treatment, if you did the operation together, they are much more, they're much more likely to take care of the patient afterwards. It helps to have knowledge of tropical medicine, or to be with someone who does, because I'm not a tropical doctor. I've been trained as a general surgeon and then as a plastic surgeon. I've been with Jan many, many times, and last time I was with Matthijs, and it helped me great to have a guy who really knows what he's talking about when you're talking tropical diseases or tropical medicine. And it also helps to know some basic things from other specialties. It's not only individual help, we talked about this, education, try to involve the locals. Carefully select what you're going to teach to whom, and try to do the operation together, get them involved, let them do the aftercare, and return to the same spot for several years. That truly helps, because you can't expect someone to fully learn a technique from 1 week exposure. Leave books, instruments, and access to the internet. I'm always there. Yep. So that's what, actually I'm finished. That's the teaching. And think of yourself. Don't forget to enjoy your stay, which is very important. Africa is beautiful. So go out, look around, and enjoy. And this is, I don't want to make a negative impression about short stay. I think short-term missions can be fantastic for two sides. Thank you for your attention.